Welcome to the Advancing Healthcare Through Simulation podcast, where we explore the people, ideas, and innovations transforming healthcare education and practice. In each episode, we shine a spotlight on leaders who are pushing the boundaries of simulation to create engaging, meaningful, and impactful learning experiences. Today, I'm delighted to welcome Dr. Anthony Seto. Anthony wears many hats as an urgent care, virtual emergency, flight medicine, and event medicine physician. He even brings a remarkable blend of creativity shaped by his background in movie making, DJing, and training lifeguards. Anthony designs innovative simulation curricula such as incorporating escape game elements, secret identities, and low-tech strategies for high-impact learning. At the University of Calgary Medical School, he is a clinical associate professor teaching medical students and physician assistant students. He is known for his engaging, practical, innovative, and clear, epic approach to curriculum design and delivery. Over 7 years as course chair of Intro to Clinical Practice and a simulation-based course that uses games, role play, and audio visuals to elevate the education experience. He continues to advance innovative teaching approaches by implementing low fidelity and gamified simulation strategies to prepare healthcare professionals for emergencies at electronic dance festivals. Dr. Seto, thank you for joining us. Really excited to learn more about your innovative and creative approach to sim.
Thanks for having me.
And so with your background you shared, you have a very diverse set of interests from movie making, DJing, even lifeguarding, in addition to your emergency medical background. How have these seemingly different experiences influenced the way you design learning experiences for healthcare professionals?
Yeah, lots of different activities that I like to immerse myself in. And I think of all these activities really feed into simulation well. So starting from movie making, there's the pre-production phase, the production phase, and the post-production phase. And when I make movies, I learned that the pre-production phase is really important. It takes a lot of significant amount of time to script write, recruit actors, designing the shots and flow. So it feels really similar to simulation in a way where I have to write immersive cases, recruit the actors and crews to be a part of it, and then design the flow. Then the project's delivered, and finally the post-project reflection afterwards. So it's organized like a movie production in a way of each piece and recruiting people to help with all the different tasks. And for the DJing part, interestingly, for both DJing and simulation, I feel like I really need to improvise on the spot and keep the audience engaged and just go with the flow. I think for DJing, I really do try to make sure I launch the set in a very immersive, clear manner and get people to buy in right away. So just like in simulation, that opener is very important to me to make sure all the pieces are very clear and people are bought in. And the design of that beginning piece, that anchor, is really important in the sim world. And then the conclusion as well. In DJing, you want to have like a nice finale. So also in the sim, there needs to be some sort of definite end or a very nice conclusion to wrap up the story. And then I think in the past, when I first started with simulation, I would be very like scripted just to make sure, oh, I want this done and this done and this done. And even with DJing, I would make sure, so because I'm nervous, making sure that, okay, this song will flow into this song and this song. And I think both worlds were very scripted. And then as I DJed more, I thought, okay, no, I just need the anchors, the beginning and the end, and little pieces of the middle, the different phases and emotions I want people to go through. And then so simulation, same thing. Now I just go with the flow. I make sure I have my must-sees. Each phase is really distinct. And otherwise, I just kind of get a flow state with the audience I'm facilitating sim with, just like I'm DJing for. And for lifeguarding, I guess lifeguarding just is a different type of context to run simulation. And I think from lifeguarding, since the demographic group is more the I guess kids, yeah, kids can take the lifeguarding since they're under 18 and moves into young adults. And this demographic, I learned to be very enthusiastic, really supportive, really psychologically safe, and lots of energy. And I feel like I translate that lifeguard aquatic training world into my simulation to also be very enthusiastic and get that engagement. And if you're having fun, then I feel like the participants also have fun and they suddenly forget about sim could potentially be intimidating for some coming in. So if you start off with an enthusiastic mannerism like we do in the aquatics and lifeguarding world, then I think that translates well to the simulation world. So that's how I kind of merge all these activities together into the sim world, and that's how it has influenced me and how it has influenced the way I facilitate and design sim.
Well, you've definitely done very well with setting the tone and creating an inviting atmosphere in any experience that I've seen. So that must be coming through from those experiences. Many people often associate simulation with high fidelity, high tech, mannequins, that sort of thing. You've championed a low tech and high impact approach, similar to your Draw Doodle Sim. What inspired this approach, and what have you learned about the relationship between technology and effective learning?
So part of my other activities that I do, I spend a lot of time in the summer working in event medicine. So I'm called the rave doc, I guess. So I work at these large electronic dance music festivals where we have lots of medical emergencies there as well at times. And we need to run some simulation to help prepare our team for medical emergencies. At the same time, we don't have any fancy simulation labs or mannequins on site. And so what I usually do is I bring my mannequin that's styrofoam-like with a torso and a plastic head, and I bring it to the event tent to practice some in situ simulation with my team. One day I actually forgot to bring my mannequin Bob, we call it. And so what I did see was on our stretcher, we had a bed sheet made out of paper. I'm like, oh, okay, well, I don't have my mannequin. I'm just going to draw on it. So I used a marker and I drew out the outline of the mannequin and I still facilitate the sim. And as people would do things to the mannequin, like IV, O2, monitor, I just draw them on. When they had interventions, I draw them on. And then I'm like, oh, why don't we just do this all the time when we don't have any mannequins? And so that kind of transformed just coincidentally, accidentally, into what I call now Draw and Doodle Sim, because I'm drawing and people are doodling. And so we call it D&D for short, which is kind of like a play on Dungeons and Dragons. And so I was curious, like, oh, okay, I wonder if this is just as effective, as immersive, and as real as other modalities of simulation. So we did do a little academic project just to see when we had learners go through draw and doodle simulation, compare that with using the mannequin Bob and other props, and compare it to finally like a higher fidelity simulation or higher physically real simulation in the simulation theater with a fully computerized mannequin, what the perceptions were. And we found equivocal results between all three. So the overall rating, the perceived engagement and participation, and then also how real people thought the sim was from a physical, emotional, conceptual lens. It was actually equivocal between all modalities. So I learned that it's like really more important to just choose a modality that really fits and matches well with your learning objectives. And the actual tech to deliver the sim doesn't really impact the engagement and perceived realism as much. So choose anything you want, even a piece of paper that you're drawing doodling on.
As long as you're fully immersed in the, details of it, I'm sure that it does come to life. That's really interesting to hear. I don't know if I have the artistic skills to bring that to life.
Art is subjective, so and we embrace all doodles and art forms. Yeah.
Very supportive. Thank you. So, you've used innovative simulation strategies to prepare healthcare providers for emergencies, like you mentioned, for electronic dance music festivals and so on. What unique challenges do event medicine teams face, and how has simulation helped prepare them for these unpredictable environments?
So for our event medicine environments, they're very low resource. And this is now compounded with the challenge of participating in teams who actually have just never worked together before. Because in the clinic or in the hospital, you're used to working with the same coworkers over and over again. Every time I go to an event, it's like different people. Sure, some people are recycled. Some people come from out of town, out of province even, to meet together for the first time. So, and then third, the event space itself, each time it looks different. This event looks like this with the medical tent, and so that varies event from event. So that's why sim becomes so important for us to team build for these ad hoc teams who have never worked together before, to go through the workflow rehearsal, to know exactly if we see this type of clinical presentation, what are the steps we're going to do to make sure things are running smoothly. And we actually found that by going through these workflow rehearsals, we've identified missing equipment that we forgot to bring, or maybe a medication we forgot to order. So we get someone to, right before the event, quickly get those things so we're ready before the event starts. And Sim also lets us practice the most dangerous clinical presentations that may happen at events.
So with teams coming together for the first time, I'm sure that, takes some time to get used to and familiar with each other's approach to work. Can you tell us a little bit about your teamersizer? What is it? Team energizers?
Teamergizers, I guess.
Yeah, thank
Yeah.
you. And how that helps focus on communication and teamwork before introducing the clinical content.
Yeah. So teamergizers is just like a truncated term to say teamwork energizers or teamwork games. It's just a catchy term for fun. So at these events, we use these teamergizers, which are just games that help energize people and are used to build teamwork and communication skills so they can practice during the game itself and then have a bit of reflection of their teamwork right before we launch into the real events. And also we put it right before simulations. I find that if we separate the teamwork activities from the medical activities, there's less cognitive load and people can just focus on strict teamwork skills. I find that once we do these teamwork skills and activities, the sims run smoother, and then ultimately our teamwork runs smoother as well. Although we didn't study it, this is just anecdotal. And now I've just in when I teach advanced cardiovascular life support, these courses or any other simulations, I routinely do run some teamergizer, and still anecdotally, I feel like that helps really bond the team together before they tackle the clinical scenarios. They just feel more comfortable with each other. And there's also opportunity after you run a teamwork energizer to debrief right away about the lessons learned about teamwork skills and communication skills to drive home those points. Then they can layer on the medical aspects thereafter in their subsequent medical simulations or in the real life clinical presentation.
Well, it sounds like a lot of fun, and seeing it with my own eyes, I can confirm it seems to lighten the tension and the anxiousness for any students that are coming into it. So I'm sure it's had a positive impact on many. Going more towards your background in escape rooms, can you tell us about your TeamSIM and how it was designed to help medical learners develop teamwork skills before layering in the biomedical content, as you mentioned? Was the vision behind TeamSIM what the outcomes were? And did it surprise you? Were there any surprises along the way during this 6-year run of the event?
Yeah, so in terms of the team sim, the overall vision was really to separate the teamwork skills from the biomedical skills. I think just anecdotally teaching at the medical school, the students have told me like, wow, going into simulation for the first time, I feel overwhelmed. I now have to worry about this new concept of team dynamics and kind of the flow working with the team, both in the physical space and just like verbally and emotionally and everything. And then learn about the medical part. So I was working in the University of Calgary chairing a course at the time, and I decided, okay, well, why don't we do some learning progressions? This is what we do in aquatics industry and swimming lessons, kind of stepwise approach. Let's remove the biomedical stuff and isolate the teamwork stuff only. at the same time, around the same era, I was working in the escape game industry for 2 years. And when I saw people going through the escape room, I'm like, oh, wow, this is like the best teamwork experience. So I thought, okay, well, I'm gonna make an escape game for the medical school that's called TeamSIM, just to focus on teamwork skills. And then at the end of the exercise, the debriefing will only be strictly focused on teamwork skills. And then after packaging the curriculum and running it, I discovered, and to my surprise, the students were very good at self-debriefing their teamwork skills. They pulled up terms like closed loop communication, shared mental model, verbalization by themselves. I'm like, great. And then we have dedicated time to talk about the biomedical stuff. My second surprise was during the COVID years where everything was online. I needed to transform the escape game online. So I, at the time, I used Google Forms, and then people would just put in their codes and it will let them know if they were correct or not. So exact same puzzles, and they were still able to communicate online. And in the end, when we just did the regular post-course evaluations of the overall score, what they liked about it, the scores were equivocal over the 2 or 3 years, I forgot the exact years, of online teamwork sim versus the 3 to 4 years of offline sim. So it both works, online or offline. And those were my surprises.
It is always surprising. You never know what that dynamic of not being in a physical room with someone could bring to the conversations, but that's wonderful to hear that it was still impactful for the students. So maybe if you could tell us about another innovative sim that you have ran, your Beep Beep Sim, and how it transformed your common on-call emergencies into escape-style puzzle stations. What made this format effective for learning, and what can educators take away from this approach when designing their own educational experiences?
Yeah, so the beep beep sim, what that stands for, beep beep is actually the sound the pager makes. That's where the name was inspired. So beep beep. So beep beep sim, one of the needs assessments for our curriculum was that students needed a way to practice what to do when they're on call for on-call situations. And so what this is was 6 rooms in a hallway, and each room had a theme. So it would be like chest pain or altered level of consciousness, fever, etc. And then within each room, as students go in, there's a PowerPoint slide that they go through that has different puzzles. And then each of those slides would have something that talked about maybe recognition and clinical presentation. And then it talked about differential diagnosis, management plan, etc. For each of those puzzles, it'll spit out a 1-digit number, and then they will put that digit into a lock. And once they unlock the box, they've successfully completed that room. And there's a QR code which they scan, and it out pops a summary slide of the content they just went through. And then once they completed all 6 stations, they come in for a full debrief and get verbally quizzed on the same concepts again. So I think what worked well about this project was that there was a lot of repetition. So repetition is good for consolidation. So the first repetition was they would go through and peer teach each other, and then they would learn it through the card. And then at the end, they would look at the material one more time by looking at the card again and verbalizing the quiz questions. And then also the variety really allows for effective learning so that they're applying skills and approaches to different stations and working as a team as well. And I think another global item effective for learning would be movement. There was movement in learning. We're not sitting in the same spot for the full 2 hours. People are walking and physically going from room to room. And I think physiologically, there must be some sort of blood circulation activating some area of the brain more when you're up and about. But I can't, don't quote me on that. This is just theoretical. I'm sure maybe there's a paper out there about movement and circulation to the brain. So overall, I think what worked well was repetition, variety, and movement. And then also giving the learners choices. They got to choose the order for which room they wanted to solve first. So having in control of your own learning is really empowering. So I think all these type of factors makes the experience more engaging, and then you'll remember things better when something is emotionally fun, I guess.
And so with each room, they got a bit of a pre-brief information so they knew what they were coming into, and that led their decisions on where they wanted to start. Is that kind of how that went?
Oh yeah, there was a overall pre-brief in a holding room about this is how we're going to pursue the activity. You're going to use your clinical resources, use each other, and go through an approach to the theme. And then you would then go. You have about 70 minutes to pick and choose, 70, 75, I can't remember the exact, to do it in whichever order you want. And then at the end, come back to see us and review everything one more time. And I guess another advantage of this, it decreases the amount of time that the facilitators needed to verbalize. Saves you can just rest. And the facilitators, it just took two facilitators to monitor the hall of 20 students to just peek in to make sure they're doing okay. However, the puzzles themselves, by going through them, it teaches themselves, the students. So the students teach themselves by going through the activities, and then the facilitators are just there to help if they had any questions or needed hints. We piloted them until no hints were needed, and ultimately, I think students were able to get through them without any hints for the most part, actually.
Nice. That's impressive. A very unique approach I haven't heard before. That sounds really interesting. So many educators often face limitations, things like time, funding, space, and equipment, I guess. You've demonstrated very well here that impactful simulation can happen almost anywhere. What advice would you give to fellow educators who want to innovate but may feel some constraints around these resources?
I think just start low tech because low tech doesn't mean low educational quality, doesn't mean low engagement, low participation, low fun, and low effective learning. So start low tech. The simplest simulation would be like a verbal simulation. You can easily go on like Zoom or go on one and just no paper, no pen, just verbally talk out a case. And I mean, they do this in real life. So when we do board certifications of emergency medicine or even family medicine, we just have verbal simulations. One person's the patient, the other person's talking through their mental model. Or if there's no actor as the patient, we can just simulate a case one on one. Then the next step on top of that would be, okay, grab a piece of paper, do something like Draw Doodle Sim, draw out the mannequin, then you want some visuals. The next step after that, you could use cutouts of papers and magazines and things just on papers to layer them on top of like a bigger poster. After that would be adding some props. So you could just find like a stuffed animal sometimes I use and just props to make your sim. And then finally, you can use the typical computerized mannequin in the simulation theater. Two resources that I may suggest if you're looking for somewhere to start just to without the technology would be a website called resusmonitor.com. So that's RESUS, so resus monitor, as in the monitor.com. And this is what I use to use like my laptop as a monitor. It can then hook up onto your cell phone and you can put in some vitals on your cell phone that will be displayed on the monitor and it's completely free. So when you're out and about, just hey, let's do a sim, sit down, put up resusmonitor.com, and then you can actively control live vitals and spit out that monitor. So that's one tip. And then the other one is if you're looking to do something as a virtual option, there's virtualresusroom.com that just uses Google Slides when people can manipulate props, graphics, like online live together. So those are some aspects, some ideas on how you can without funding and space and equipment, just to do some low tech things to start off and be creative with it.
That's a great, thank you for sharing those resources. I think the creativity piece sometimes can be tough coming up with some ideas, but from what you've shared today, I think it could get a lot of folks started and taking it in their own direction. So thank you for that. As the Associate Medical Director of the ESEM Provincial program, you've had a unique view of simulation across Alberta. What emerging trends do you see shaping the future of simulation, teamwork training, and interprofessional education?
I think the technological piece is creeping in. And in the future, like for example, I'll just paint out AI, VR. Those are two areas that's kind of starting to creep into the simulation world. So think about using AI for debriefing, especially to collect thoughts from the participants and then quickly transcribe some generic themes can be used. VR, a lot of different simulation conferences are having these headsets for people to try. So it's very interesting with that technology that you can use VR or even without the headsets, maybe some like screen-based applications where you can play multiplayer when you're not in the same setting. So if you're in a distributed site, rural site, remote site, or even to have these simulation experiences with international colleagues all around the world through technology, I think that is a cool area that's starting up. And then thinking about how to do some simulations distantly. So, for example, how in the clinical world we have these remote tele type of physicians. We can also do distance simulation where we can do a video conferencing call in to have a subject matter expert or a sim facilitator be there virtually to facilitate sim for you if you don't have the local resource. So that's kind of new. It's been more prevalent, more and more so. I think there's always the emphasis of psychological safety that's still not the future, but I think more emphasis on it in the most recent years for sure. And identifying emotions in the debriefing phase. A lot of times we ask people how they're feeling, and it is really hard to identify and label our emotions. So work in that area, and as well thinking of ways to engage uh, individuals who may not know too much about sim or be hesitant to start sim, those areas as well. And finally, I would throw in maybe a bit more of video integration, whether it be pre-recording pre-briefs or using videos to set the scene using multimedia. Even with the NAIT cave is, or I'm not sure what you officially call it, using big immersive theater and using some technology with audio and visual effects to make the experience more immersive. So there's lots of different areas that I've seen across the province.
Yeah, I agree. I think there's a lot of opportunities with the technology that's come along. I'm very interested to hear what you come up with next because you seem to be on the cutting edge of new innovative sims. So, lastly, to end things here, Anthony, I want you to kind of reflect on your career so far and maybe share what has been the most rewarding moment that convinced you of simulation can truly change the way healthcare teams train and work together.
It's tough to think of like a particular moment. I think each part is very rewarding. And I think maybe what is rewarding for me is the amount of context. Maybe it wasn't a moment, but the same moment of multiverses of moments where every single context I can see lots of changes in ways teams work together. So, for example, in the event medicine world and in the in situ teams, or looking at the rural and remote and looking at telesims and online sims, looking at the lifeguard world, actually, people training lifeguards are running simulation. So I think the most rewarding is just seeing how simulation is so beneficial in so many contexts. And I'm just impressed by the breadth and the scope of simulation in such diverse contexts. So my theme would be I'm very feel rewarded with being able to enter and look at and appreciate so many different contexts and how simulation has really transformed training and learning for all these sites.
Well, thank you so much, Anthony, for joining us on the podcast here today. Really appreciate you sharing your passion for simulation and for the learner-centered approach. Really reminds us that impactful education doesn't always require high-tech solutions, like you said. So thanks again.
Thank you so much.
This series is proudly produced by the team at Road 55. Road 55 creates content that connects. For more information, visit our website at road55.ca.